Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and greetings everyone. Welcome again to Bicara Sihat, where we discuss on current health issues. My name is Nur Farhia Zefri and I will be your presenter and moderator for today's episode. In this episode, we will dive into a topic of jaw tumor and oral cancer, both are critical health conditions that often goes unnoticed. But an early detection and a proper care, this patient can be diagnosed. So here joining us today in today's episode is our experts from maxillofacial, plastic and reconstructive surgery of Pantai Judicial Specialist Center, Dr. Anantharajan and also Dr. Hisham Majid, our dedicated surgeon with an extensive experience in handling jaw tumor and oral cancer. Assalamualaikum and hello doctor. Thank you so much for joining us in today's episode. We hope our upcoming discussion can enhance our audience knowledge and provide more awareness on these two issues.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Farah, for the brief introduction for both of us. So this morning, first and foremost, I would like to thank Pantai Judicial Specialist Center, PJSC, and also RTB, Radio Television Brunei, for inviting us as the panel discussion on jaw tumor and oral cancer. So as a brief introduction as to what oral cancer and jaw tumor is, as you can see in the picture, it's a picture of the oral cavity, or what we call the mouth. So mouth cancer can be defined as any cancer that arises within the mouth or in any of these structures described, and it can happen to all the range of ages of people. Whereas the jaw tumor essentially is also part of oral cancer, but then it is localized within the jaw itself. So if the tumor arises within the jaw itself, either the upper jaw or the lower jaw, that will define as jaw tumor.
Okay, from your extensive experience, doctor, where do these tumors commonly develop?
Good morning to everyone. As the name implies, the jaw tumors, it arises within the jaw itself. It can be either in the upper jaw, where we call it as the maxilla. It's mostly on the palatal surface, and from the lower jaw, we call it as the mandible. As for the oral cancers, it can arise from any of the structures within the mouth, starting from lip, then mouth. It can be on the tonsil, tongue, base of the tongue, and on the oropharynx. It could be on the floor of the mouth.
Okay, so how do we differentiate between these two, specifically in terms of the symptoms?
Okay, that's actually a good question, thank you. So obviously these two conditions are different from each other. So jaw tumor, so I'll start with jaw tumor. Patient can come with complaint of pain or swelling with or without pain, or they can come with presentation as loose teeth, or suddenly experiencing expansion of the jaw bone, whereas, for example, the jaw is one side different in size to another. Whereas oral cancer, or what is defined as mouth cancer, it can happen within the mouth itself for the soft tissue. For the soft tissue lining in the mouth, when the symptoms can be pain or ulcerative pain in the mouth, which wouldn't go away, or it could be a lump in the mouth. And in patients with extensive disease, it could also be arising within the neck itself, like as a lump in the neck. Okay, that's all.
So for our audience that are not familiar with this kind of imperfection, doctor, can you please expand on the early signs of system that we should look for, or are there similar symptoms as mentioned by Dr. Hisham?
As Dr. Hisham mentioned, we just need to look for any persistent ulcer or sore either in the lip or in the oral cavity, mouth, tongue or tonsillar bed, and you look for any lumps, and you look for any red patch or white patches either on the tongue surface or on the inner lining of the cheek or on the tonsils. So, and also you can look for any changes in the tissue around the teeth. So these findings are a bit concerning. So if any of these symptoms persist more than 2 to 3 weeks, we strongly advise to consult a doctor or dentist.
So, okay doctor, there is a common associated between the public. Once you have found to have a tumor, there is a risk of being fatal. So in the case of jaw tumor, how true is this association? And at what point can we consider jaw tumor as a high risk of being fatal?
Okay. In terms of, I think there's a general misconception that when somebody is diagnosed with tumor, then it is going to be fatal. So it's not always like that. So it always depends on the stages that we found it on how big the tumor is. Normally, if the tumor is found early, at the early stages, especially both jaw tumor and oral cancer, both of them can be treated at as early as possible, then the condition won't be fatal. It's just like when the patient presents at a later stage and where it is not possible to save it, and where the tumor has gone, metastasized to other parts of the body, then we can say that the condition is going to be fatal at that point.
Okay, so following the question before, is there a possibility of jaw tumor could develop into a cancer? And if there is, what would be the cases that would lead to this?
To answer your question, first question, generally the jaw tumors are mostly benign, but it can change to malignant due to genetic mutation and due to environmental factors. The risk factors, it is same as for any head and neck cancer, but for oral cancers, it is mostly the tobacco and excess alcohol consumption, then chronic infections, certain strains of human papillomavirus, specifically the type 16, which is a high risk variety, and poor dental hygiene, and diets which are low fruits and vegetables can cause also, it's a risk factor, can be a risk factor.
Oh, okay. So let's shift this discussion to the cases from your knowledge. What are the primary factors for someone to develop a jaw cancer or a jaw tumor?
So before I answer that question, I would just like to show the audience this picture that I on the screen. This is an example of how a tongue ulcer can look like, not should look like, but this is we can see the ulcers here around the lateral border of the tongue. Okay, so now just about the risk factors. So the most commonly known risk factors are cigarette smoking, or tobacco chewing, or betel nut chewing amongst the Asian countries, and also alcohol consumption. And uncontrolled sexual activities can also predispose patients to HPV viruses, which have also been proven to be the cause of oral cancer. Apart from that, then there's poor oral hygiene, and in immunocompromised patients as well, and then like passive smoking.
Okay, so how about oral cancer? Does it have a high mortality rate, or can disease be managed?
The oral cancers are not always fatal. If the disease is detected in the early stage, we can the 5-year survival rate is about 83%. But then if it goes for an advanced stage, then the 5-year survival rate drops significantly. So it can be it can drop up to 38% if it's a stage 3, stage 4 disease. But overall, the survival rate of oral cancer is about 66%, a 5-year survival rate.
Okay, so how about lifestyle factors? Are there any specific lifestyle that would potentially increase the risk of developing these conditions?
As I mentioned before, there's the cigarette smoking, and also the alcohol consumption, and then also the habits of betel nut chewing, and also tobacco chewing in some countries.
Since these conditions, doctor, grow in the oral cavity, in terms of early detection, can regular dental checkups help with this kind of early detections?
Yeah, it's advisable to have a regular dental check so they can pick up the disease early, so it will help for a prompt early treatment.
Okay, in terms of treatment options, can you explain to the audience what are the options available and what stage are the treatments recommended?
Okay. For this, the treatment option would be for early cancers. For early cancers, if the cancer is detected early, then early surgical resection and plus or minus radiotherapy afterwards can be given to the patient. But in patient with later stage tumor, then more resection would be needed, and that means like more of the normal tissues will be removed. So that then reconstructive option, for example, what we do to replace the tissue that we have removed will have to be discussed with the patient. And then there's also immunotherapy as well as another option, and also for patient with recurrent or really advanced disease, immunotherapy will be another option that we can consider.
Okay, in terms of maxillofacial reconstructive surgery, what role does reconstructive surgery play in the treatment of processed jaw tumor and oral cancer?
The reconstructive surgery plays a significant role. It's a very important role in any tumor resections of the head and neck. So, as I said, one, it improves the functional. So it helps in swallowing and speech, and also it addresses the facial disfigurement. So it improves the aesthetic, and also by providing a dental rehabilitation, it offers a psychological benefit to the patient.
Okay. Are there any side effects to the treatment mentioned? Does it impact mobility of the jaw or the way their oral cavity works?
Yes, it does impact the mobility of the jaw because, as I've mentioned before, it's a surgery which removes part of the jaw which they've been living with for the life, basically. So there will be side effects in terms of the surgery side of things. There will be side effects, for example, the inability to open the jaw, and also inability to eat with the jaw, and inability to speak or chew as normal. So there will be changes. So we normally advise the patient that this will happen even before they start their treatment. And then in terms of radiotherapy, the patient would have side effects of trismus, which is inability to open the jaw, and dryness of the mouth, and also sometimes the infection in the oral cavity can happen as well, like mucositis. For chemotherapy, then the patient can have side effects of oral ulceration, multiple oral ulceration, and multiple infection as well. Yeah.
So after these treatments happen, so how long does it? Patients always ask, like, how long is the recovery period? When are they going to return to their normal activity? And what can the patients help to shorten the recovery period?
I think to answer this question, the recovery period following a reconstruction depends on the stage. Surgery generally takes about 6 to 12 months for full recovery, including the new adaptation for the rehabilitation. And the radiation, it usually takes about few weeks to several months, and chemotherapy also has the similar time frame. So immunotherapy, it has its own side effects, which it takes about few months time.
So are there any cases in your experience that the tumor would recur or grow back after the surgical removal?
Yes, definitely. Any form of cancer will have recurrence, basically. I mean, it just depends on the extent of the tumor itself. In an early stage, let me just rephrase that answer. So it depends on when the patient is diagnosed or when the patient presented, which stage of the tumor is the patient diagnosed and treated. So the later stage that the patient been diagnosed, then the higher chance of recurrence is there. And if the tumor has gone down to the neck, or if the tumor has metastasized to other parts of the body, then the rate of the recurrence is higher. So that's why we always advise patients, even after their treatment, to come back for follow-up.
Yes,
in the first 2 years, because the chances of recurrence is higher in the first 2 years of post-treatment, then we always advise patients to come back for clinical examination, just to rule out for any recurrence every 3 months. And we recommend doing a CT or radiological examination every 6 months within the first 2 years, as the higher chances of recurrence is there within the first 2 years. And then after 2 years, then the year 3 and 4 and 5, then we can lengthen if it allows, we can lengthen the period of follow-up to 6 months and a year. But then if, for example, there is a recurrence within that period of 5 years, then we will go back to square one, so start from zero again. So until the patient is tumor-free for 5 years, then we always have to follow the patient up for this risk of recurrence.
So it means that the review is very
importance of
important
follow-up,
in this kind of treatments.
Yes.
So let's talk about prevention, doctor. In your opinion, how can we raise awareness about jaw tumor and oral cancer to encourage people or the public to seek for early treatments?
We can organize social programs either through the media, or we can conduct some shows. Then we can arrange some regular follow-ups, the meetings, so that it can create awareness among the public.
Okay. So my final question is, before we end this discussion, doctor, what is the takeaway that you want our public or our audience to take back for today's episode?
The main thing that we want to the audience to take home is how patients should get checkup for if they have any ulcers in the mouth, or if there's any jaw swelling that they have, which happens suddenly. Just have it checked basically. And then for example, if they have ulcers which has been there for more than 2 weeks, just advise them to go to any doctors or dentists in the practice and to have it checked, and at least to have it biopsies. And also for more importantly, lifestyle prevention of this disease, because it is not well known, but it is there. So it can happen to anyone, to any patients, or sometimes the problem is when patients present late, and it's difficult for us to, difficult for any healthcare professional to treat the patient if the presentation is late. So I just want to sort of show one of our slides to the public in terms of the cases that we have seen in our center. This is Brunei patient, the patient that was treated for for the past 5 years for jaw tumor. So as you can see, the presentation is here. There's a slight swelling. All she has is a complaint of swelling in the lower jaw. So that's all she has. And then we've done a CT. This is the appearance of the CT. So basically we did treatment for her. So this is an example of the same tumor, a bit more extended in the actual surgery. So this is how big the tumor is. Even though initially it didn't look that big. So it is when we open it, it is quite extensive. Okay, so sometimes the patient didn't realize that because of the lack of knowledge or lack of awareness among the public. So going back to for the treatment that we mentioned before, the reconstruction treatment, if we have to resect the jaw, then we have to replace it. That's the general term. So this is what we do. We will take the bone from the fibula, from the leg, and we will attach it to the plate that we provide for the patient, and we'll attach it to the patient's jaw, as to say it is a new jaw for the patient. So this is an example of the treatment that we provide in PJC for treatment of jaw tumor.
So as Dr. Hisham said, for the oral cancers and jaw tumors, so as he said, it's early detection and prevention is the key actually.
Yes.
So one should adopt a healthy lifestyle and early regular dental check.
Yes, regular.
So it will
helps
pick up, it will pick up the disease early and can be treated.
At MF Percy of PJC in Hospital Ripas, any patient who has had part of their jaw removed due to benign tumors or malignancy could replace the resulting surgical defect through jaw reconstructive surgery. This surgery is to restore the patient's jaw as much as possible to the original position, therefore allowing them to have a near normal oral function. Before surgery, a 3D model of the patient's jaw will be produced from his or her CT scan to better analyze the extent of the disease and help in the surgical treatment plan, from figuring out how much bone is needed to shaping the bone graft to match the original jawbone. To repair the jawbone after removing the tumor, the surgeon will take a piece of bone from the patient's leg, called the fibula, along with its blood supply, and use it to replace the missing part of the jawbone. The choice of leg bone is taken according to the position of the jaw cancer, either the left or the right side. To ensure continuous blood supply, the surgeon will connect the blood vessels in the leg bone to the blood vessels in the neck through a procedure called microsurgical anastomosis. A section of the skin will then be taken directly above the fibula bone to cover the soft tissue section of the jawbone, which will be removed together with the tumor. The skin defect of the leg will be covered by taking another skin graft from the thigh. After surgery, the patient will remain in the ward for at least 10 to 14 days to be monitored, and will only be discharged once he is able to eat and drink orally, and move with the help of physiotherapists. The patient will then be monitored through regular outpatient clinic appointments for the next 2 to 3 months. 6 months after the surgery, the patient will then visit a dental specialist to assess his suitability for dental implants to restore proper oral function. However, this timeline could change if additional treatments such as radiation or chemotherapy is needed. Dr. Anand are going to expand more on the topic of jaw tumor and oral cancer. So, Dr. Anand, how are you? Okay, I'm good as well. Can you explain to me the parts of the jaw and oral cavity, the anatomy?
Yeah, as I said before, I just want to show with an illustration where the public can understand better. So as we said, the oral cavity means it includes from lip, the structures from the lip to the back of the throat. So these cancers, they can arise from any of these structures, either from the lip, gum, palate, tongue, floor of the mouth, and back of the throat. Most of the time, these cancers arise from the tongue. So it accounts for about 30 to 40%. Then floor of the mouth, about 20 to 30%. And from the lip, it's about 10%. The rest, all around 10 to 20% accounts for about, okay? So when you look at these slides,
So this is the common areas.
this is the clinical presentation I want to show, just for them to understand. So normally, either it presents as a lump, or it as an ulcer, or it as a white patch. So in this photo, we can see that there's a nodule on the lip, and on the tongue you can see a big ulcer, so which is not healing for more than 2 weeks. So any ulcer in the oral cavity which is not healing for more than 2 weeks, ideally we need to do a biopsy to rule out malignancy or cancer. Sometimes it can present as a white patch which doesn't go, so we need to be careful with these patients. We still need to do a biopsy. This can be an early stage. Then sometimes it can present as a lump, or in advanced stage, these cancers can present as multiple swellings in the neck. So it has a varied presentations. So normally the contributing factors, as I said before, tobacco and smoking. But in the younger generation, the recent trend is due to HPV virus infections. There are hundreds of strains there. It be a low risk group and a high risk group. The low risk ones cause genital warts, but the high risk one, especially the type 16, can cause oral cancers. There's certain difference between the cancer caused by the human papillomavirus and the one which is caused by tobacco and smoking. The patients with human papillomavirus infection are of younger age group, and the prognosis is much better than the smoking and tobacco chewing. So this human papillomavirus vaccine, there are vaccines available, and study shows that it is beneficial in preventing the high risk HPV infection, so probably reduce the incidence of oropharyngeal cancer. Just for the public, this jaw includes both the lower jaw and the upper jaw. We call it as the lower jaw mandible. The upper one is the maxilla. And then when you look at that photo, so most of the time these jaw tumors are benign, like 95 to 98% where we come across here, they are benign.
Unlikely to change.
Unlikely to change. But sometimes we do come across malignant conditions in the jaw. Most of the time these tumors, they present as a cystic lesions. They arise from the remnants of tissues which are for the development of the teeth. And sometimes it can develop from the bone. So just want to illustrate few examples. In the upper maxilla jaw tumor, most of the time they present as a swelling over the cheek, or when you look at intraorally, it can be present as a swelling on the palate or on the labial buccal sulcus. So these patients needs evaluation with imaging. That's why I just want to show the CT scan where you see that it's a big cystic lesion on the maxilla. The other one where you can see like a radiation, that is a primary malignant tumor of the jaw. Just to illustrate for the lower jaw, sometimes it presents as a contour abnormality of the jaw, and intraorally you can see as a big lump in the jaw. Sometimes it can present as a loose tooth, multiple loose tooth. So all this requires further evaluation with imaging.
So it is very obvious actually from the face.
Yes, most of the time it is obvious, but sometimes the patients, they go for a dental treatment,
yes.
then they do an OPG, and they find incidental finding and they refer to us. First we do OPG, an X-ray, and based on that we still need to do a CT scan to assess the lesion.
So is it possible for you to show us some of the surgical procedures then?
Yeah. I just want to show one or two cases for oral cavity and for the jaw tumor. So this is a patient with, we can see a large ulcerative lesion on the tongue. So the markings which we show is the lesion. The outside marking is the one we are going to resect. So we are going to resect that much of tongue. It's going to relieve a big defect. So obviously the patients will find it difficult to swallow, speak. And in this case, we need to reconstruct with some tissues so that this anatomical continuity is there. So normally we take the skin paddle either from the forearm, or if it's too big, sometimes we can take it from the thigh. Here we have taken it from the forearm, and this is the skin paddle from the forearm which we use to reconstruct the defect, the tongue area. So we can see a different color, but then for such a big defect we need to put some structures to reconstruct. The donor site where we harvest from the hand or forearm is not going to cause any disability to the patient. This is another example where we can see a big lump on the palate. This was excised fully, and then this was allowed to heal on its own, and you can see there is no,
It looks actually perfectly the same.
Yeah, perfectly the same. Yeah. Then for the jaw tumor, I just want to illustrate one example. This is a young chap who came with a contour deformity of the jaw, where the OPG showed a big osteolytic lesion where almost the half of the mandible was destroyed. And CT scan was done, where this is a 3D CT, where you can see that there is a complete destruction of the jaw on the left side. So we are going to resect such a big jaw swelling. We need to reconstruct it. Otherwise, the patient will have a significant contour deformity of the face. They find it difficult to swallow. So what generally we do is that we do what is called a stereolithographic model. So we get a CT scan. This CT scan data is converted into a digital format, and this will print the exact jaw. So
The
patient with including the lesion. So this is the jaw, and this is the lesion where you can see. So we replicate to the duplicate like the other side, and this is what the jaw looks like, his original jaw. So based on that, we need to reconstruct it. So we get a titanium tray exactly fitting into the contour. And so then
This is everything that we do in the lab of the maxillofacial.
yes, we do everything here. Then after that, we harvest the bone from the leg. So this bone is contoured, and exactly fit into the tray, where you can see that the last photo where the tray is there and then the bone is in place. And this is the healed photo where you can see his occlusion is good, and there is no deformity at all. And this is the last photo here. This is after 2 months later after surgery, where you can see the contour looks the same.
Okay, so from this kind of surgeries, doctor, how did it impact their daily lives of the patients, and how did it also impact their mental health?
The oral cancer can profoundly impact both the physical and mental well-being of the patient. Physically, the patient will have pain due to the ulcer. They find it difficult to swallow, the speech also will be affected, very uncomfortable. So, and this disrupts their normal routine life. And furthermore, the patient will have chemotherapy, and radiation adds to it. Because from chemotherapy and radiation, they feel fatigue, sometimes dry mouth. They find it difficult to cope with it. Yeah. So mentally, if we say, like any other cancer, these oral cancers are also equally distressing. So this can lead to a bit of anxiety, fear, and depression in the patients. So we need to address all these issues.
So how did it impact their daily lives, and it can cause any mental health issues to the patients after the surgery?
The oral cancer can profoundly impact both the physical and mental well-being of the patient. Physically, because of the pain, they find it difficult to do the daily activities. They find it difficult to swallow. Speech will be affected. Okay, so mentally, these oral cancers can also be equally distressing like other cancers, so leading to fear, anxiety, depression. The changes in the physical appearance from either from the jaw tumor or from the advanced cancer, and can cause patients to withdraw from social situations. It can lead to a bit of loneliness and depression. It can cause, it can strain the relationship, and sometimes the family members, partner, and also the friends, they find it difficult to adjust to the new changes, sometimes difficult to frustration. Also on the mental side, patients may have financial loss. So this treatment can go for almost a year or so. Yes, constant review, or from the disease they have to take a long break. They can put financial stress. So that's why I said it's a comprehensive care is very essential for these patients to come out of, to face the daily activities. Yeah.
So after the surgery, how did this surgery improve their daily activities? Compared to before?
Yeah, oral cancer treatment can improve significantly the patient's daily activities. Okay, physically, from surgery or radiation or chemotherapy, they aim to either reduce or eliminate the disease. So the patient feels better, or it gives a sense of well-being after the treatment. Yeah. So rehabilitation, reconstructive surgery, as we just saw, and rehabilitation therapy, they also help to address the functions, appearance. They address the appearance to improve the appearance and restore the functions, so they feel better after surgery. So basically, multidisciplinary approach is very essential. So it helps the patient to recover faster. Once they feel physically better, they feel emotionally better also.
So basically, the patient have to commit to this kind of what do you call that, treatment, yes, in order for them to get better. Yes. So how did the doctors and nurses here in PJC help in their recovery period after the surgical treatment? What did we provide to them?
The doctors, the combined treatment of doctors and nurses during the recovery period is very essential for the patient to heal physically, emotionally, and psychologically. The comprehensive care provided by the healthcare workers and especially from doctors and nurses help them to recover not only from surgery but also help them to return to their daily life with as much normalcy as possible.
That will take some time.
Yeah. During the recovery period, both doctors and nurses, they continue to provide the medical care. They try to find or early detection of any of the complications if the patient is going in. They pick up early, and also they provide pain medications so that the patients will comfortable
And
reassurance. Yeah, and most of these patients with oral cancers, the main issue is the swallowing and speech. So doctors and nurses, they coordinate with the dietitian, so make sure the patients get adequate nutrition during the recovery period. And the other area is the speech. We coordinate with the speech therapist, and this is very important for the patient. And the wound care infection, where the nurses play a significant role. They take care of the wound management. They educate the family, patient and the family members how to take care of the wound at home. So on the emotional front, the nurses also provide a vital support by providing reassurance to the patient. So they also help us to provide regular follow-up, and so that the treatment can be monitored. And apart from that, the other support groups, the nurses also help to connect with the other support groups and rehab services, so that the patient will recover fast. So as I said, both comprehensive and compassionate care for the patient is very essential during the recovery period, so that they can return to the normal work or daily activities as soon as possible.
Okay, doctor. Out of curiosity, for example, if I have a wisdom tooth and it got impacted, but I didn't go to the dentist to remove it, what are the implications of that?
Wisdom tooth, otherwise called the buried tooth, generally doesn't cause any symptoms, but sometimes because the space is so narrow, the gum over the impacted area can be swollen, and it's quite painful. Painful, yeah. So sometimes it gets infected, and then you can have pain in the neck as well. So we may have to treat with antibiotics. But if you have a wisdom tooth, I strongly advise to go to see the dentist, so that they can do an X-ray, see if there is any cyst developing around the buried tooth. So if there is a cyst there, sometimes if this cyst is allowed to grow for some time, it can even destroy that mandible in that area. Sometimes we do get a lot of referrals from dentists with cyst around the tooth, which we extract it. The wisdom tooth, the cyst which develops around the wisdom tooth or impacted doesn't change to malignancy, but then it can be locally eroding. It can destroy that segment of the bone there. If it is a smaller segment, we don't need to reconstruct. We just extract and leave it to heal on its own. But then there's a quite significant destruction. Then we need to reconstruct that.
So, doctor, what's the incidence rate of oral cancer and jaw tumor in Brunei Darussalam for the past 5 years? And how can maxillofacial provide a treatment for this kind of conditions?
To answer this question, I don't have exact data for the last 5 years, but I can give you data for the last year. Last year we had about 6 or 7 cases of oral cancer and about 15 to 20 cases of jaw tumors. Oral cancers, when we talk about oral cancers, then out of which 50% is operable, then 50% come in the advanced stage, so where we can't operate. So we have to send him for palliative care first, or sometimes we downsize the tumor by giving chemo and radio, and then we'll reassess the patient for surgery. And for the jaw tumors, mostly it's benign conditions. I think I rarely remember just one case of primary malignant jaw cancer we operate. The other mostly are benign conditions. It's mostly of benign cyst from the dental. They refer from the dental side actually. So it's mostly of benign conditions, jaw cyst.
Benign conditions. Do you consider that kind of case to be very complicated or difficult case, or is it can be treated?
To answer that, if it is detected early, for as I said before, if it is stage 1, stage 2 disease, and we can treat with surgery. But then if it's an advanced stage, we have to go with chemo and radiotherapy. And for the jaw tumors, most of the time it is resectable unless it has spread, breached the mandible, and it's involving the soft tissues, I mean involving the floor of the mouth or extending into the neck. It's too extensive, then we can't.
Oh, so doctor, in terms of the services that maxillofacial provide, can like these kind of conditions we treat in maxillofacial and we don't have to send it abroad? Like what kind of services that maxillofacial provides?
Yes, definitely. Even for the past 5 years, we've been treating oral cancer and jaw tumor cases solely in MFPRC only. Basically, from the time of resection and also reconstruction, we can provide the services in MFPRC. We also will send the specimen to our pathologist for analyzation. And if the patient needs radiotherapy and chemotherapy, the services are here in PJC. That we can send for the patient here for further treatment of radiotherapy and chemotherapy after the surgical treatment has been completed. So to answer your question, it's definitely possible.
Possible to be treated everything here.
Exactly. So because we've been doing the treatment for patients of oral cancer and jaw tumor for the past at least 5 to 10 years.
Okay. So maxillofacial, does it have like any advancement or a special machine that treat these conditions?
To answer this question, for example, a patient comes with a huge jaw tumor. So once we are going to resect it, we need to reconstruct the defect with a bone. So previously, we used to take a bone from the hip and we'll just put a tray on it, and then but the bone take is not that good. So that means when the patient go for rehabilitation, dental rehabilitation, the quality of bone is not that great. And sometimes these patients require radiotherapy. When they give radiotherapy, most of the bone resolves. But then now we have the stereolithographic model where we make exact replica of the jaw. So even before surgery, we know the amount of resection, and we make a customized tray, and then we measure the length of the bone which we need to put. And usually we take it from the leg, and this we will connect to the vessels in the neck. So this bone is live. So the amount of resorption is less. Even if they go for radiotherapy, the quality of the bone remains. So in the later stage, when they go for a dental rehabilitation, the quality of the bone is so good. So it helps in dental rehabilitation at a later stage.
So just to add on to what Dr. Anand is saying, so in terms of the rehabilitation, of dental rehabilitation, after the period of surgery and chemotherapy or radiotherapy, so we also have the specialists in our department which can provide the patient with dental implants. So the patient not only, so that the patient can at least as much as possible go back to the normal routine before they have the resection done. So the dental implant services are also provided solely within the MFPRC department, done by one of our specialist implantology colleague, Dr. Tumours.
So is there any kind of advice that you would provide the patients before undergoing the surgery?
So we usually have a family discussion, and we'll with the family members. Then we explain them about the surgical part and also the post-op, about the radiotherapy and also chemotherapy. So we try to explain to them the recovery period, how long will it take, and then we try to explain to them, they let them understand the full process of recovery, and then the side effects from either the chemotherapy or radiotherapy. And we generally organize a tumor board discussion combined with the medical oncologist and the radiation oncologist, so that they know what treatment they were going to get after the surgery.
Oh, okay. So what is your hope for maxillofacial surgery, and what is the thing that you want to improve for the treatments of for the treatment of jaw tumor and oral cancer? What kind of like hope that you want for the future to make these kinds of surgery easier for you both?
I think extensive research is always going on. I think what we can do is not to sort of like to always update ourselves with whatever the research is going on, not just in Brunei but abroad also. So people are coming up with all these different equipments and sort of like techniques to improve the quality of treatment and quality of care for the patient. So I hope I also hope that we can also provide some form of like extensive research in terms of the patients in Brunei.
Yes.
And what we can do, because I know the population in Brunei, the genetic makeup of the population in Brunei can be different from obviously the other parts of the world. So if we can have sort of like a research project that we can do within our department, just so that we can improve the quality of treatment that we give for the patient from time to time.
From time to time.
Exactly.
So my next question is there kind of like, is it very common for jaw tumor to happen here in Brunei?
Yeah, to answer that, usually the risk factors, we need to consider the risk factors. One is the genetic predisposition, then the other risk factors. I think previously the elder generation, they have the habit of chewing the tobacco.
Nuts, yeah.
They used to have the betel nut, which with areca nut, and then just used to keep it in the mouth. So now I think due to the health awareness program, that sort of practice is coming down.
Coming down over the years.
Yeah.
Okay. Well, doctor, we have a questions from the public. Apparently, this person was asking is how do we eat after the surgery?
It's a good question. Yes. So we need to, when we look at the staging of the cancer, so when they come for either cancer of the tongue or jaw tumors, so post-surgery swallowing is going to be a problem. So we anticipate that. So before surgery, what we do is that we need to take care of the nutrition post-op.
Yes.
So we generally advise them, explain to them about feeding.
Yes.
So because after surgery, most of them require radiotherapy. So this is going to be a long process. We expect the duration between 6 to 12 months. So what we do generally is that to improve the post-op nutrition, we generally put a small tube in the abdomen for feeding. So we call it as the PEG. So through which the nutrition can be provided during the post-operative period till he recovers fully. So generally we keep him till his swallowing is good. So in the post-operative period, we'll ask the SLT team to assess whether his swallowing is good, because when you remove half of the tongue, his swallowing is going to be a problem. So we are not in a hurry. We generally wait till all the treatment is complete and his swallowing is good. So then we will remove the tube, which we put in the abdomen for feeding.
Okay, doctor. In addition to that, how about speech? How do they talk?
The speech will also be a problem because we need the muscles. So even though we reconstruct, the reconstruction part doesn't have that same muscle as the normal structure. So it's going to be a problem. Speech will be a problem.
Oh, okay.
So that's why we send to the speech therapist.
Speech therapy.
They will take time and then they see how much they can improve their speech. So in any case of oral cancer or jaw tumors, especially oral cancers, speech and swallowing is going to be a long-term problem. But our speech therapist will try to help what they can to improve the patient's condition.
Okay. So next question is, I think this is quite common. Like, how do patients like to know what to expect? Like in terms of their features, is it gonna be a scar or is it obvious? And how do we, after that?
The scars, it's because we do a better reconstruction now using the pre-model. So it's not much deformity we can expect except for the neck scar. And the neck scar we usually treat, there are options of treating the neck scar. So we generally put on silicone gel sheet and we have lasers for treatment for the scar. So most of the scars are generally okay unless they have a tendency for keloid formation. Otherwise, the scar appears good.
So the scar is good after the
Certainly,
operations. And next question is, I'm going to touch on more on mental health issues. So do we send patients to therapy after the post-op or a few months after that?
So before, I think from the day when the patient is diagnosed of oral cancer, jaw tumor, we've already sort of like prepared themselves. I think it's very important to point that out, because the patient needs to know, and also in Brunei context, the family needs to know. So basically, as Dr. Anand has mentioned, we will organize a meeting with the family members, as much as whoever wants to come, and a specific meeting where we discuss with the family members, with the patient, about the diagnosis and the treatment, and also what to expect after the treatment, especially how long what kind of side effect is there, side effect that we have mentioned, and how long will it be, and what is the impact on their sort of like lifestyle and well-being and mental health. And also, apart from that, if the patient agrees or if the other patient agrees, we also ask the patient who has had the condition or who has had the treatment with us to share their experience.
Their experiences, yes.
Exactly, because this patient has actually gone through the actual experience, and they can provide with a better understanding on the patient point of view, and that we find that will help the current patient understand the condition a bit better, because they know that somebody has gone through it, somebody is sort of like has experienced the same thing, and then they have sort of managed to get through with all the process of the treatment, and can give them more insight of the experiences of the treatment. Okay. So that's what we find helpful.
Okay, thank you to those who have asked questions through our QR code. Hopefully all of our questions have been answered. Thank you once again, Doctor. Hopefully we all meet again at another time. Well, from the explanation that we just heard, we can understand both the oral cancer and jaw tumor is quite common here in Brunei Darussalam, and early detection and treatment can prevent severe disability. Therefore, making sure that we all go to dental checkups and avoid things that can contribute to the risk of oral cancer. If there is any discomfort in your mouth that does not heal after a week, immediately seek treatment. And a single treatment can make a significant difference in terms of treatment outcomes and improve the patient's quality of life. Thank you to everyone who have attended. May this Bicara Sihat program benefits and bring awareness to all of us. All right, that's it so far for our discussion. Till we meet again at another time, prevention is better than cure. Assalamualaikum warahmatullahi wabarakatuh.